Healthcare experts are emphasizing the need for healthcare workers to approach every case of diarrhea as a suspected instance of cholera until a definitive diagnosis is made. Is this the way to go? Well, it's a cautionary approach. It's in response to South Africa's first cholera death back in February. It followed the arrival of the virus from Malawi. Let's bring into the conversation Dr. Jeremy Nel Wits University's infectious diseases expert and specialist joining us this morning. Dr. Nel, good morning. I appreciate your time. Do you agree? Is this the way to go? Every case of diarrhea is to be treated like cholera? Good morning.
Morning. I don't think it's possible to treat every case of diarrhea like cholera in the sense that this is still a minority of cases of diarrhea clearly in the country. But it is definitely true that people need to consider it a lot more in the current outbreak circumstances. So specifically for those patients and doctors looking after people in areas where there's cholera, obviously nearly every case there you should at least suspect. But outside of those cholera areas, certainly a big red flag would be the sort of watery diarrheas that lead to bad dehydration, which is quite uncommon in adults for other causes of diarrhea. So it's about having a higher index of suspicion on the part of healthcare workers. And certainly if you're in an area where there have been cholera cases, for the patients to be much more concerned and to demand really early treatment and diagnostics in those areas.
Yeah, I suppose it's not even just necessarily, Doctor, I'm sure you agree, for those living in those areas like Hammanskraal, but also if you've traveled through there, if you've been in the area for whatever reason, and you think even if by mistake you may have had water, even with a cup of coffee or something, to maybe be extra careful. Now, obviously, we are very aware that this is a morning show. People could be having their breakfast, Doctor. But I'm going to ask if, at all possible, what point in a concern around diarrhea do you need to get yourself to a doctor and not just your local pharmacy? Maybe everyone eating their breakfast, just put your breakfast down for now.
Yes, so apologies in advance. So I think the two big reasons or two big times to be concerned is, like I said, one is if you're in the area where there have been cases or you've been passing through or you've been drinking water out the rivers from the areas where there have been cases. In those cases, any form of diarrhea should really prompt you going to a healthcare facility, your nearest clinic or your GP to get tested, because this can progress pretty quickly. For those people outside those areas, it's really when you have a diarrhea that's severe enough that you're extremely dehydrated. That is a trigger to at least say that we need to be testing for cholera, because, like I said, that's quite uncommon with other causes apart from cholera. So it's a trigger to say that you should go and get at least tested. And the big thing there is not to delay in those sort of circumstances, because the amount of fluid that you can lose in cholera is extreme in severe cases and can lead to quite bad trouble in quite a short period of time.
I suppose the rock and a hard place here, Doctor, tell me if I'm understanding you correctly, what you just explained is it's all about rehydration to stop the dehydration. But the problem is, in an area like Hammanskraal, it's probably the water that's made you sick. So how do you get around that?
Yeah, it's a great question, and that's one of the underappreciated things. It's very easy to say, well, don't drink the river water, but communities may require that may be the only source of water. So what you can do to make it safer is do one of two or three things. You can certainly boil it, but in this country, you can imagine that requires quite a lot of energy and electricity potentially, and that may not be an option. An alternative, which is pretty easy, is to use some sort of household bleach, and the key is to get the right sort of ratio. So it's about a teaspoon of something like Jik for every 20 to 25 liters. If you let that settle for an hour or two, that should be then safe to drink. It does taste a little bit funny, but it's very safe to drink at that point. If you are lucky enough to be in an area where you're getting assistance, people are providing bottled water, for example, or chlorine tablets. Those are also safe, but as you rightly say, it requires an intervention, really, because you can't rely on people. It's easy to say to have a safe water supply, but if you don't, then what are you going to do? So something like boiling it or adding a bleach is the way forward.
It certainly is not going to smell very, very good, but it might be the safer way to go. Dr. Nel, forgive me if I'm asking what could be, in your world, a very, very layman question, but we're also hearing reports that cholera can be spread through food as well. I'm just trying to get an understanding for people watching at home who may be concerned, I suppose especially in Hammanskraal. When we talk about being spread through food, does this mean that I can't share a slice of pizza with my wife if I suspect I might have cholera, or can it be spread like that, or is it food that's prepared in water potentially that is infected with cholera? Just help me understand how it's spread through food, because I would assume that's been cooked and has had been treated with high temperature.
Yeah, if food's been well cooked and you know the supply chain is adequate, there's no worry from that. It's relatively uncommon to get it directly from food, but you can get it if the food's been washed in contaminated water, or if the contaminated water's been used as part of the cooking process, and you haven't got a high enough temperature. So it's not common. Certainly, if you have a cholera patient, you shouldn't be spreading, or you shouldn't be sharing food. But you know, there's no big worry for those people who have access to otherwise safe food. That's not going to be the way that people are getting it. At the moment, it's really river water, so people drinking river water or bathing in river water where it's contaminated. Sometimes borehole water, or water where it's not, you know, from an adequately treated municipal supply. It's really mostly water. You can get it from food, but it's not the common way unless you're in that region and really washing the food or using that sort of water, contaminated water, to cook it.
Yeah, so there we go. So that's what we all need to be looking out for, especially in areas where there could be a risk of cholera. Dr. Jeremy Nel, I thank you very much indeed for your time. So Wits University's infectious diseases specialist as well. It's really all about this dehydration, which is the biggest issue. Yes, of course, the diarrhea, as we mentioned. Apologies, we know it's a morning show, but it's the rehydration, which is so important to get done as quickly as possible.